Already, happy Monday, everybody. Happy Monday. Happy Monday to you. Happy Monday. How was your weekend? I am so blessed that you could join us for afternoon tea with Jesus today. We're going to have a wonderful time. Today, I have Dr. Asare, and ladies, we're talking about women's health. Today, our focus is on miscarriage. What is miscarriage? I know that there is no right or wrong way to react to the pregnancy loss, and many women have gone through this process. It is not something new. A lot of women have a lot of emotional pain whenever you lose a child, whether it's a fetus or a 9 months old baby or 6 months, it doesn't matter. Pain is just pain, and everyone goes through it in their own different way. But this morning, as we throw some light on this, my prayer is that you will be educated. You will hear something that will help you to encourage yourself to know that, look, it's possible and it can happen for you. This is a very sensitive topic in a way, but it's very dear to my heart. And I've always, the last time I spoke to Dr. Sari, I said that, look, we need to do a program on this because this is something that occurs all the time. So I want to know where you're watching us from. I want to know, I know most of you are on right now. Thank you for joining. Thank you for being a part of Afternoon Tea with Jesus. Where are you watching from? What are you having? I'm having just green tea today. Just green tea. I added a little milk to it, no sugar, and just, getting myself ready for afternoon tea. Hey, so I want to say that welcome, welcome, welcome. Let's have this powerful conversation. You will be so blessed. Let me know what you're having this wonderful afternoon. All right. So before we get into our program for today, I just have a word that I read in Habakkuk chapter 3, 17. It's a great word of encouragement. And I wanted to share this with you. If you're going through miscarriage or you have experienced miscarriage lately or you've lost a child, I know a lot of people, a lot of women that have gone through this. And sometimes, like I said, there is no right or wrong way to react. There's no right or wrong way to encourage someone. And so I just want to read the scripture to you before we begin. And I will invite Dr. Sari on. Dr. Sari says she's having green tea and she's commenting on mine. Green tea and milk pa. Green tea and yes, I'm having green tea with cream. Actually it's cream, Dr. Sari, it's cream. It's cream. It's cream. So Cynthia is having plain green tea, no sugar, and she says, "Welcome, Dr. Sari." Yes, welcome. We love you. We love her very much. I'll tell you a whole story about Dr. Sari later when she comes on. Okay, she doesn't know I'm going to say this. So we love you very much. All right, Habakkuk chapter 3, verses 17. Let me read that, and then I would invite her on. And please share this broadcast. Invite someone, be a part of the afternoon tea program, subscribe. We're going to have a wonderful time, wonderful discussion. She's a great doctor. If you're looking for a doctor, I will recommend her. And if you're pregnant, well, by now you should have a doctor. But if you're now beginning and you want your how do you call it, your delivery room to be spectacular, then you need Dr. Sari. She will make it fun. Honestly, it's a painful time in our life as you're pushing that baby through. But I'm telling you, if you have Dr. Sari beside you, she makes it all better. Okay, so let's go on. Habakkuk chapter 3, verses 17. Let me read the word of the Lord. It says that even though the fig trees have no blossoms, and there are no grapes on the vines, even though the olive crops fail, and the fields lie empty and barren, even though the flock die in the field, and the cattle barns are empty, yet I will rejoice in the Lord, and I'll be joyful in the God of my salvation, for the sovereign Lord is my strength. Well, the Lord is your strength. And no matter what you're going through, Habakkuk says that even though it seems like things are not going the way I want it to, even though it seems like there is so much pain, even though it seems like I've lost that child, even though it seems like that, the doctor's response is like, look, you're not going to have a child. It's impossible. This can never happen. Even though it seems like that, He said, "Yet I will still rejoice, for I know that my God is sovereign, and in his wisdom and in his own way, he's able to bring to pass my desire." So this afternoon, this is my encouragement to you. Habakkuk 3 verses 17. Rejoice in the Lord. Trust in him. He's able to bring it to pass. Already, happy Monday. Let me know where you're watching from. Let me know the tea you are having. Please share this broadcast. Let's share this to as many women as possible. It is definitely going to be a blessing to someone. So I will be right back, and Dr. Sari will be right back with me, and we're going to have a very wonderful, wonderful time. So happy Monday, everybody. Thank you so much for joining. I'll be right back. My name is Mariana Samoa Enim, a witness to the gospel of Jesus Christ in this generation. When I began preaching the gospel nearly 10 years ago, I could only dream about what God is doing today. In the past 8 years, we have seen many documented salvation cars through the ministry of Jesus' Lord Crusades. It has been an honor to see many people come to the saving knowledge of Jesus Christ through the preaching of the life-changing gospel. Children, young men and women, the sick, the poor, the rich are all accepting Jesus at an unprecedented rate. Many nations, cities, and towns have been transformed. In the year 2014, God opened a door for me to bring the gospel of Jesus to the people of Pretoria, South Africa. This divine assignment opened the continent of Africa and drove me to travel to cities and towns, preaching to small and large crowds. I am grateful for what God has done, but there's still room for more, and I know we have just begun. The truth is that none of this was done alone. I am only a steward. The Holy Spirit has been everything and more. He has given me the support I need through family and provided a team that has been with me since day one. Many have stood with us over the years in prayer and with their finances. So the vision for the next decade is to see millions come to Jesus, uncountable number of people experiencing deliverance, healing, release from satanic bondages, and the dead being raised. With God's help, we will continue to preach the gospel and reap this miraculous harvest of souls. We will see 1,000,000 souls in the next decade. I believe what God has promised. He will surely fulfill it. Alrighty, welcome back to Afternoon Tea. We're having a wonderful time today. We're talking about women's health, miscarriage to be specific. We're focusing on miscarriage today. And today I am joined here. I wish she was here today, honestly, like physically sitting next to me, but she's in her home. And we're going to have a nice time, Dr. Sari and I. Let me just invite her on. Everybody, drum roll. Let me know where you're watching from, and I want you to share this broadcast. We ask you to, if you're watching on YouTube, please subscribe and be a part of the Jesus is Lord Crusade family. So let me bring her on. Dr. Sari, welcome, welcome.
Hi, everybody.
You're looking fancy with your top.
I combed my hair.
Just because you were coming on afternoon tea, yeah.
Yes, I was on call all night. I woke up for you guys.
Oh, so how many babies did you deliver last night?
Oh, how many? It was one. Then I came home and they kept me up all night with two other people. I left it for the next person.
Oh, okay. Baby girl or boy?
Hey, there was no men this weekend. It was all girls.
Oh,
Yes,
girls. Oh, that's
yes.
nice. That's nice. Well, how does it feel like, delivering babies? I mean, even
Oh,
before we fun, really?
absolutely. Well, the excitement never goes away. It's always a thrill. I mean, how else are you going to continue in this business if you didn't like it? 3 a.m.
How
party.
many years have you been doing this, Sorry.
Let's see. Since 1989. So how many years does that make it?
Wow.
89, yeah. Yeah.
Wow. Wow. Wow.
Always,
Well,
always fun.
we love you, Dr. Sari. We love your
You guys are
family.
kind. Thank you.
Yes. Oh, we love you. We love you. When I posted the flyer, well, a mutual sister. a mutual friend reached out to me and said, "Oh, I love her so much." And I said, "Yes." And then I said, "Yes, she's a really good person." And then she said, "You're more than a sister to her. And I was like, "Yeah, it's a mutual thing. We all have the same connection
For
with
saying that.
you."
Appreciate it.
Yes.
Yeah.
And it's fun to have you in the delivery room, honestly.
I do come up
When
with
you,
these usually.
Dr. Sari delivered my second son, honestly, and it's just a joy to have her in the delivery room. I'm not sure why my thing seems. I think my yeah, I'm frozen. I don't know. I don't want to restart because then we will be cut off. So let's go on. Not sure why it's happening, but at least you can hear me, right?
Yes, we can. At least I can. Yes.
All right, then let's go on. Let me just make sure that everybody can hear me. All right, Cynthia, you're watching. Can you hear me? Let me just make sure that everybody can hear me. Not sure why this thing is happening today, but anyway, at least it's not
Technology.
frozen on a baby face, like at least there's a smile on the face. So and I don't know what's going on. Anyway,
Mhm.
hopefully it will come back. So let's see. All right. So, like I said, Dr. Sari delivered my second son. And I always say that it's a joy to have her, in the delivery room. My sister shares the same experience. She's just a joy. I remember when I had my son, I had a delay in the. Dr. Sari, do you remember the umbilical cord was stuck in there?
Oh, yes.
Uh-huh,
Yeah,
uh-huh,
those have to be
uh-huh.
special. Mm-hmm.
Yeah. The umbilical cord was stuck in my, wherever. It wasn't coming out. Usually it's supposed to come out right after, right, Dr. Zari?
It should come within 30 minutes.
It should come within
Most of
30
them come
minutes.
out within a few minutes, and then a few stragglers will drag on. So you have 30
Okay.
minutes before you have to go get it out. Hmm.
All right. So mine took a while. It came within 30 minutes though.
Yeah.
But I thank you because I was panicking at that time, but you were just so relaxed about it. It was like, yeah, 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 stop it. It will come eventually.
Yeah.
And then at one point you came in and said, well, you better pray that it comes or else I'm taking you out for surgery.
Yep. Yeah.
So
And
it's
then
always
how it hasn't came out. Hmm.
it came out. It came out eventually. So it came out eventually. So thank you so much for the love you have shown to my family. Thank you for being such a great doctor. And everybody who comes to you testify of the same thing. And so we're grateful to have you in our lives, not just a personal, sister to us, but to all those that your patients and all those that you give yourself. I want you to introduce yourself to. We know that you're not new to the program, but introduce yourself to those who don't know you. And let me see if I can get this camera to work. So please
Okay.
introduce yourself. I'll be right back. Please go on.
Well, my name is Thelma Asare, and I'm in private practice with a group um, in the suburbs of Baltimore, Towson, and Owens Mills. And I've been back in Baltimore since 1996. I trained at Hopkins, and then I left for 3 years to Philadelphia, and then I came back here, and I've been back since then. Um, do general OBGYN. Um, know a little bit about everything, but I concentrate on OB and GYN. Um,
Mhm. Yeah. And you do GYN. When we think about GYN, let's think about pap smears, right?
right. Well,
Sorry.
well,
So
people
just
assume
one
everything
quick,
with a gynecologist has to do with a pap smear. Yeah.
okay.
We have done a good job of educating women. So now
Mhm.
everybody thinks everything is a pap smear, but it's not just pap smears that make you go to the gynecologist.
Mhm.
Other
Yeah,
issues.
of course, there are additional things, but
Yeah.
when I hear a gynecologist, the first thing that comes into my mind is pap smear. Get
Mm-hmm.
pap smear done, and
Yeah. Not a
I
fun thing,
I
but
don't
who
I
doesn't?
don't want to repeat what you said to me when I was
What did I
getting
say?
my first pap smear done with you. My goodness, I don't think I want to say that on air, so I'll just keep
Hey,
that.
you are a priest, though. Don't say that.
So I won't. But that is how much fun you have with her when you're in her presence. All right. So, Dr. Zari, today we're talking about miscarriage, and I think I read some statistics online today that says that about 10 to 20% of known pregnancies end up in miscarriage. Miscarriage is not something that is new to us, but I want you to tell us or help us understand, first of all, what is miscarriage and what are the causes or the risk factors associated to that. As you talk, I'm going to see if I can get this camera to work. I'm not sure why I'm still frozen.
Well, miscarriage is when a pregnancy ends, and depending at what time in the pregnancy it ends, you get different names for it. So if it's before 10 weeks, um, it's considered in the embryonic stage. After 10 weeks, is in the fetal stage. Um, and the more pregnant you are, the longer you are, the less the chances are. People take that to mean that once they pass a certain stage that they cannot miscarry, and that's not true.
Mm-hmm.
Um, if somebody delivers after the point of viability, you call it a stillbirth, but it is
Mm-hmm.
still a miscarriage. The causes are numerous, and the causes for early miscarriage differ from what may make somebody miscarry later on in pregnancy. Um, but in early pregnancy, some smart person studied tissue and
Mm-hmm.
found out about 50% of them are because of genetic abnormalities.
Okay.
Um, you said something about that miscarriage is not new and it's rather common. But
Mm-hmm.
if it happens to you, you think you're the only person who has it.
Yeah.
For those of us who are in this business, it ruins your day, no matter how often you've seen it. It's just not what you expect.
Mm-hmm.
Um,
Mm-hmm.
but it is not uncommon. And I always tell patients, this is not dinner time conversation. It's not like
Yeah.
you go sit and go, oh, I had one, let's say. But if you open your mouth, you'd be amazed how many people have had one.
Mm-hmm.
Um,
I think today we're just gonna keep this thing because I keep freezing. Do you see that too?
yes.
Yeah, I don't know why, but
But
anyway,
again,
let's
this picture is
have.
also very nice.
Yeah, so we'll keep it on. So
Mhm.
hey, as long as somebody can hear us, let's just go
I can hear
on.
you.
All
Mhm.
right. Okay. So what are some of the risk factors? Because I don't know if you talked a little bit about it, but um, w- maybe about two or three main reasons why you think that is age a factor and all those little things.
Number one thing is is no risk,
Okay.
but age is definitely a factor,
Mm-hmm.
right? Um, I like to tell women that when your mother made you, you got all your eggs. You don't make new eggs.
Okay.
Okay. So you got everything you're going to get by 3 months of age. By 12 weeks, the majority, all your eggs are done. And the eggs
Mhm.
are dying. We
Yeah.
call it a treasure. So those that are left, as you get older, they become a little hard headed.
Mm-hmm.
And when you go to make the process of an egg or oocyte, which is what you need to unite with the sperm, sometimes it can kind of veer sideways. And
Mm-hmm.
so the older you are, the more of a chance that that can happen, and you have with basically an abnormal, what we call karyotype,
Okay.
abnormal chromosomes, and
Mm-hmm.
that can cause miscarriage. It's not just on the women's side, by the way. Uh,
Mm-hmm.
it's on men and women. Now, men make sperm every 3 months,
Mm-hmm.
but they can also have something go wrong when they're trying to make, the sperm. And so, in your human body, you have our cells have 46 chromosomes. You get 23 from your mother,
Mm-hmm.
23 from your father, ideally.
Mm-hmm.
Um, the process of taking your normal cells, okay, your oocytes, which has 46 chromosome to 23, is very complicated. And I tell people it's amazing that we end up with a normal human being when you think
Mm-hmm.
about all the things that can go on.
Yeah.
That process can be more likely to be abnormal as you
Mm-hmm.
get older, right? So, if you decide you don't want to have children and then at 45 you wake up and you want to go make one, number one, you're faced with the chances of fecundity, the ability to get pregnant being less, and then more of a chance of something being abnormal. And when it's abnormal, depending what abnormal chromosome is on there, it will
Okay.
end up in miscarriage. Okay.
So then, you know what? We forgot to cheers to opportunity with all these things. So
Oh, well, I
since
have my water right here. So
I've
cheers.
remembered, yeah, there's no structure to the show. So what are you having?
I'm
Sorry.
having water. A big glass.
A big glass of water.
Yes,
Okay.
that's right.
All right. Okay. So cheers again, Dr. Sari, and welcome. Sorry, we're having all these technical difficulties, but at least we're pulling through. So let's
That's right.
just keep at it. Alrighty. So I when you were talking about the risk factors, some of the things you mentioned was age.
Yes.
And you even passed a comment that if you just decide to wait till 40 something to have a child, there is a probability
Mm-hmm.
that you might experience miscarriage at some point, right? And
Right.
so do you advise that maybe if all you are able to check all the boxes, then it is better you have a child at what age
The
then?
earlier the better.
The earlier the
I
better.
joke. I joke that you know what, teenagers should have children except they don't have a lick to their name.
Mm-hmm,
Tell you
mm-hmm,
that, right? So the younger you are, the better. So I always tell patients, they come, oh, I just bought my house. I want to finish the house with furniture and things, and I always say, there isn't a good time to have children. If you're blessed to have somebody and
mm-hmm,
you can do it earlier, it's better. Nowadays, I think people think that they can just go and pick and go and get pregnant, and so
mm-hmm,
if you are able to do it when you're younger, please do, right?
mm-hmm.
When people hear about famous people in the uh, in
The
society
movie
having children at
industry.
49 and 50 and things, I beg you, most of it is not their eggs. Okay,
Yeah.
people have saved eggs.
Oh.
It is not. I mean, we've delivered people who are older, but there's only one woman in my how many years of doing this who conceived spontaneously at age 49. One,
Miraculously. Mm-hmm.
one.
Mm-hmm.
Okay,
Mm-hmm.
most everybody else early 40s we see, but it is not common. You just don't. You may get pregnant, but it
Mm-hmm.
usually does not end well. Okay,
Yeah. Mm-hmm.
so if you have a chance, please do it sooner. Okay.
If you have a chance, do it sooner.
Yes.
And also for those who are struggling, no matter how your age is, I think for those of us who are believers, we believe in miracles. Of course, there are so many countless examples in scripture. And so we hold on to that to know that it can happen for you as well. So, Dr. Sari, all right, before we go on, we had a few technical difficulties. So I've missed some of the comments and welcome and all of that. So please, if you're watching, Angela, thank you for watching. I want you to share. If you're on, let us know what tea you're having. Just say a quick hello. Let's feel encouraged that you are on here, and so that we know that we are all a part of a community. And today we're having a conversation on miscarriage. I want you to just share your story if you have any to share, or a comment or a question to Dr. Sari. Help me run the show today. So, Nana, God bless you. Thank you for the thumbs up. I'm not sure what that emoji is, but thank you. Thank you. All right. I lost most of them because I had to refresh in the midst of the program. All right. So, Dr. Sari, if someone is having a miscarriage, are there signs they can look for? What happens? What exactly does the body go through? Because I've heard stories where someone will have to be on bed rest for a number of days, maybe throughout the entire pregnancy, because if they stand up, the baby will come. So, what is the truth about this? And
That's in Ghana. That's where they keep people on bed rest. Bed
really?
rest is out the window.
No, Doctor. Sorry, I've heard people. I mean, the okay, this
Well,
famous.
I think you're thinking about cervical incompetence. Okay.
Okay,
You're
yes,
thinking
yes,
about when people's services are weak,
yes.
so they tell you not to put pressure on it. We
Mm-hmm.
don't do bed rest anymore. Okay.
Oh.
Okay. So the only time that happens is in cases where we don't know that somebody has a weak cervix.
Mm-hmm.
And so they come nowadays, you do sonogram,
Mm-hmm.
and cervical incompetence is when your cervix gets weaker as you get more pregnant.
Okay.
Okay. So usually it's in the second trimester. It is
Mm-hmm.
not in the first trimester. So miscarriage early is something totally different. So in the second trimester, you go for your sonogram, and
Mm-hmm.
nowadays we do measure cervical length,
Mm-hmm.
and there is a range, like all of us, there is a range in how long a cervix should be.
Mm-hmm.
So when it's out of that range, and if your cervix is what we call shortened, okay, depending on when we catch it, we may be able to do something about it.
Okay.
Or if you can't do anything about it, then they may put you kind of on your head, trying to
Okay.
prevent pressure on it. So you
Okay.
hear stories about they told me not to get up and all that stuff. But if we know that somebody has lost a baby like that before, when you get pregnant early, we put a stitch and you go about your business. Now I know where we come from in Ghana, they will pack you at Kwalebu in the private ward and you sit there and you don't get up. That is really not necessary. Okay. Uh, Pregnancy increases
But
your risk.
Dr. Sarah, before you go on,
Mhm,
you said that you get a stitch.
mhm.
So where is the stitch?
The stitch is on your
In
service,
your pinky?
in your service,
In your,
inside the
you
pinky, on your service. The
you
service
and
is
I
what.
have a name for we have a private name for for our thing. So, but I don't want to put it out here because that's between you and I. But for the sake of all the women that are watching, probably today we'll call it our
It
pinky
is.
pinky.
It
Okay,
is. It is.
our
It is
vagina.
your service with what opens for your baby to come out vaginally.
Okay.
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 So when that and it should not be opening until at the end of your pregnancy. So
Ah.
when it starts opening beforehand, and depending on when it is it happens, you can lose your pregnancy.
Okay.
So cervical, this is an aside, but a cervical incompetence is a painless dilation of the cervix. You do
Mhm.
not know what is happening until
No.
the very end. Okay.
Okay.
Until
So
all
this
of a
is where you
sudden
start bleeding, right?
that you may not bleed, you may just have a little more discharge or a little watery thing, or you will start dilating. At some point, you will start cramping, and that usually alerts people. You go to the hospital, and no, we can see membranes, the sac coming out. So
Mm-hmm.
if it comes out that way, and you're the hospital and stuff, then we put you, upside down in a very what we call Trendelenburg,
Mm-hmm.
to try and hold the membranes in.
Okay.
Um, and so that is kind of a separate issue than a miscarriage where um, there the way people usually know is you
Mhm.
start bleeding. So you've missed your period, you tested positive for for ACG, so you know
Yeah.
you're pregnant, and
What is
either
HCG,
ACG
please?
is human chorionic gonadotropin.
Okay.
It is a hormone that is produced during pregnancy.
Mm-hmm.
Okay, in early pregnancy, there are levels that are measured.
Mm-hmm.
It does not correlate one on one to anything.
Mm-hmm.
So people come and say, "What is my ACG level?" And that means I'm 5 weeks pregnant. That is
Yep.
not really the case. There's a huge overlap in
Mm-hmm.
that hormone being produced.
Mm-hmm.
Okay. And so, I mean, some of the lowest numbers you see on people who have IVF, because they are checking, they can
Yes.
see the number is 9. 9
Okay.
is like, this is nothing. But in a
Okay.
normal pregnancy, the number should go up in a particular way.
Okay.
So sometimes we use that to follow up whether this is a normal pregnancy or not. But in most people, they will start spotting, right? Or
Mm-hmm.
they will cramp, accompanied with spotting. And
Yes.
they will come in and you will check. The easiest ones to diagnose are those who've had an appointment, we've had a
Mm-hmm.
documented fetal heart tones on sonogram, and then they
Mm-hmm.
come for the appointments or they bleed and the heart tones are gone. That
Okay.
is a relatively easy diagnosis to make.
Okay. Okay.
Now, sometimes you don't know there's anything going on. You come for your first pregnancy appointment. You know your last period was such and such date. Your periods are regular. We expect that we should see a baby that is, say, 10 weeks, and you do
Okay.
a sonogram and you're measuring 7,
Okay.
right? And there's no heartbeat. Okay. And
Mm-hmm.
so that makes you worried that that's what it is. And there are strict criteria as what diagnosis that is, right?
Mm-hmm.
So sometimes you know, and sometimes you
You
don't.
don't.
Okay.
Okay.
The ones that you don't is what we call a missed abortion, right? Missed
Mm-hmm.
abortion. So you've aborted, but you don't know.
You
So
don't
there's
know.
no tissue
Okay.
there and there's no heartbeat. Okay. And
Mm.
those ones are always the ones that are tough because everything is going fine. And
Yeah.
then you come over and, oh, by the way, there's no heartbeat, right?
I see. Well, Cynthia has a question.
Mhm,
I'll get to mine in a few minutes. But
mhm.
Cynthia is asking, what causes a woman to have the thin membranes that you talked
Okay.
about? Is
A
it genetic?
thin, weak service, for lack of, I will explain it that way.
Okay.
Nobody really knows.
Okay.
Okay. Now, sometimes, um, and it looks like is maybe something that is genetic because now we are diagnosing more women who've never lost a pregnancy with
Mm,
shortened cervices because of sonography looking. Okay. And we don't know when somebody has a short cervix and what we call funneling membranes. So the membranes that kind of,
mhm,
if you see a cervix, it looks like that.
mhm,
Okay.
mhm,
The baby is up here with the membranes.
mhm.
And when you have a shortened cervix, the cervix gets shorter and you may have the membranes kind of going down into the
Okay.
cervix, right? Depending how far down it comes, it may
Mhm,
be a problem, and sometimes it may not be. I always think that now we look, we see, and sometimes we intervene. Who knows? Like Ghana or someplace where people don't have the means to go, somebody may be walking around, they may get to full term with it. But we
mhm,
do know that there are some people who go on and may keep thinning out and may actually basically go on and miscarry. So depending what you see, you intervene, right?
okay. Okay.
And we don't know why that is, but it appears to be some inherent problem with the service, and you don't know that until you get pregnant. The
Okay.
other risk factors are in people who've had um, multiple cervical procedures, people who have
Mhm,
terminations. Okay, if you're very pregnant and you terminate a pregnancy and the cervix has been dilated many times, the
mhm,
cervix will get weak, and
mhm,
sometimes that puts you at a higher risk. But a majority of people have not had such a thing, and they just kind of show up, and it happens. I've had people who've had full term pregnancies,
mhm,
and the next pregnancy they do this, which
mhm.
kind of makes no sense. But I've seen that also, right?
All
And
right.
unfortunately, Black women, we
Mhm,
are at risk for it. We seem to have it more so than Caucasians um,
mhm.
in this case. But a cervical incompetence is not quite clear. Um,
Okay. So we don't know whether it's genetic or it's just
no,
could it
it's
also
not
be
that if your
maybe
mother had
too
it
much
that you're going
sex?
to.
Could
Say
it
it
be
again?
too much sex during maybe the first trimester of your
I
pregnancy?
always joke with you people. Get it while you can, because when the kid comes, you're not going to get it. No, there is no.
I had to push this in to get Dr. Sari to, to come into
There's
her own. Yeah.
no, oh, well,
Linda is.
there is no contraindication to having intercourse. But as long as nothing happens, so people will call, oh, I had sex and it doesn't feel good. Okay, well, don't do it.
Okay. But is it good
Okay.
to have sex during pregnancy? I mean, since we're talking about this, or if you've had maybe a miscarriage before, is that something you need to be careful of when
Um,
you're
it does
having
not.
separate?
Intercourse does not cause miscarriages.
Oh,
Okay,
okay.
so this thing
Right
of
now
when people spot and bleed, even I do it.
then.
Please lay off the sex, stay easy and stuff. Because, being normal human beings and Dr. Googlepedia, as I call it, when you have a miscarriage, everybody has something to say.
Yes.
Ah,
Yes.
you're working too hard. Ah,
Yes.
you did
Yes.
too much. You stood in your feet. You always have something to say. And as a human being, you always second guess yourself.
Mm-hmm.
So if you have what we call a threatened miscarriage, every time you spot during pregnancy, that's what we call it, because most of the time you can't figure out what's going on. If it's early pregnancy, you go get sonogram, the heartbeat is there and everything's fine. We always tell you, please, no intercourse, take it easy until you stop bleeding, because if you do and you miscarry, I guarantee you're going to blame your husband or whatever you did for it. So it's really a psychological thing.
It's a
It does not
psychological
prevent,
thing.
it has nothing to do with that.
No
You
wonder.
can lie there and do nothing and you will still have a miscarriage. There are
Miscarriage.
certain cultures where they don't. I won't tell you who they are, but they
Mm.
literally they get pregnant and they don't touch each other.
I
And they
see.
have miscarriages like anybody else.
Oh,
Okay.
okay.
So it has
Well,
nothing to do with that.
to all the ladies watching, you heard Dr. Sari. Stop using this as an excuse. Especially, I know one lady watching right now, and she uses this as an excuse. So it is you I'm talking about. All right. So okay. So let's go on. All right. If you're watching us on YouTube, please subscribe, share this broadcast. There's a lot of information that is being shared. It will bless a lady in your life. So please share. Let us get as many women to enjoy this program and learn something and help ourselves if we find ourselves in this position. But I pray that you will not. Alrighty. So then,
One more thing. Talking
mhm,
about when you talk about the risk factors, so age
yeah.
is one. There are more unusual things.
Okay.
Um, the abnormalities of the uterine cavity. Okay, um, can cause somebody to have a miscarriage. Okay, um, the uterus in its formation, and when your mother is making you, there are kind of interesting things that can happen. You know, uterine diabetes, people can have two uteruses. Somebody has a half of a uterus.
Mhm.
You know, fibroids, which are very common in Black women, um, don't prevent you from getting pregnant, but depending where the fibroid is, if the pregnancy implants on an area that is not the best, that can cause you to have a miscarriage.
Okay.
Okay. So, in fact, if you have what we call a submucous fibroid, a fibroid that is in the lining, close to the lining of the uterus, um, and you can't get pregnant, and you go and see my fellow infertility people, they usually will tell you to remove it before they try and do IVF because they want the best chance of you being pregnant, right? Um, but fibroids in of by themselves don't cause miscarriage. Okay.
Okay.
But depending where it is, it can. All right.
Okay. All right.
You also hear about um, progesterone deficiency.
Mhm.
Progesterone, people go on Google and they want, give me progesterone and things. Luteal phase deficiency is quite uncommon. Okay. And so if somebody keeps having recurrent miscarriages, I sometimes, and I do it, people call me, sure, you can use progesterone. And my reason is because it's not going to hurt you. And what if you're the unusual person where this is really the case? But to investigate it, in fact, nobody even investigates it anymore. It is quite complicated to investigate it to get that diagnosis. So we'll just give you progesterone, but it's not after one miscarriage, right? You have to kind of keep doing it before we start thinking maybe this is a problem. And then there are other um, um, diseases, antiphospholipid syndrome, where you have autoimmune diseases that can do that. So there are a few things that you can look for, but most of it has no reason.
Okay. So now to my next question: how soon after a miscarriage can I try to conceive again?
As soon as you get your next period, it used to be we'll tell people, oh, wait a few months. You know,
Yes.
we've done studies and it shows that there's no reason to do that. So as soon as your period comes on, you can try.
You can try.
And if you're not trying to be pregnant, that's a different story. But if you want to be pregnant, once your period comes on, please, you start. And so I tell people, um there's a lot of women who will get pregnant and then they start their vitamins. Those of you who are trying, or if you know anybody who wants to try, you need to take your multivitamins with folic acid 3 months before you conceive. 3 months.
Why is that?
Because the reason for vitamins is not it makes you fertile. The folic acid in it prevents or decreases the incidence of spina bifida, which is when the spinal cord forms. By the time you miss your period and you go see your doctor, the spinal cord is formed. That little bitty bitty 6 week thing, everything is kind of done. Okay.
Okay.
And so that decreases the incidence of spina bifida. And so now, because 50% of pregnancies in this country are not planned, we are putting folic acid in everything, trying to get you to do the right thing. It's in your cereal, it is in your whatever, right? So, all my young ladies who are in childbearing years, I always tell them just take a multivitamin every day. It doesn't have to be quote unquote prenatal vitamins, right? Just anything, Centrum, with folic acid in it. Take it 3 months before. And if you're thinking next year, I tell you to do it now because who's going to remember 3 months before they want to try? Just take it every day. That way you're doing the right thing, right? Uh, so I tell those who have a miscarriage, please keep taking your vitamins because if you want to try soon after, just keep doing it. That way you don't have to stop and stop, right? Mhm.
But there's also, of course, the pain and the emotional suffering that people go through.
Mhm.
I know someone who's lost about six children.
Mhm.
They just keep getting miscarriage, sometimes 3 months, 4 months, 5 months, 6 months. I think that, like I said, it's not a new thing. There are also those who go up to 8 months and then lose a child. Are there like support groups or what can be done? I mean, of course, we are pastors and so we know what the spiritual part, but physically, what can be done for that individual to be able to at least get to that place where it doesn't make it, it doesn't feel like it's their fault or it's their body, and maybe for some weird reason, their body is not cut out to hold a child and all that kind of things that people put out there.
There is support groups.
Mm-hmm.
Okay, there are support groups where from however young pregnant you were until those who've lost full-term babies,
Mm-hmm.
you go. And I encourage people to go. People deal with things very differently.
Yes. Mm-hmm.
Um, Sometimes somebody in their attempt to try and console you may come across as insensitive. So
Mm-hmm.
the first is, you can have one. They
Mm-hmm.
don't mean it that way, but somebody will take it, very poorly depending on where the emotional state is, right?
And even
And
our
so,
culture, the way our culture also
yes,
play a
yes.
role in it. Mm-hmm.
Mhm. And so, going to a support group is not a bad idea, you
Mm-hmm.
know. And depending, where you are. I mean, I'm fortunate. I'm a GBMC, and they have. COVID has messed everything up, but
Mm-hmm.
they will direct you to the group, and some people find it very very useful. Some people feel like they must go to counseling. Either you go to somebody like your pastor, or you go to a mental health person who
Yes.
speaks to you and explains and just tries to kind of get you in a place where hopefully you feel like you can get up and try again, right?
Mm-hmm.
um, of course, the best thing that fixes everything is if you're able to be successful at achieving a pregnancy, but I don't think anything makes it easy. I like all losses except time, right? um, and so and I don't give. I always encourage everybody, because I had one young lady who I remember had 5 miscarriages, and every
Mm-hmm.
time it happened I was on call. I did 5 of her DNCs.
Mm. Yeah, that was my next question too. Yeah.
5. So when she got pregnant the next time, I said, this baby better come on my day, because
Mm.
otherwise, and I was lucky. It came on my day. I didn't plan it. That was the happiest day. But you know what? It's not that you can't,
Mm-hmm.
and you don't give up. You get up and you try, right? But going to a support group, going to counseling, going to your pastor, anybody who you can speak to, just to kind of just talk. It doesn't fix the fact that you lost a baby, but talking to somebody is a very powerful thing. Just to, just vent, you know.
Dr. Sari, let's talk about DNC a little bit. Many years ago, I used to work in a doctor's office, and I remember this lady who came in, and she was about, I think, 4 months pregnant.
Mhm.
And then, of course, she had to go through this DNC thing. And it was, I saw her maybe a couple of weeks after, but I could just see the pain, and she's like, and they had to let me push my own baby out. I can't remember whether she was 4 or 5 months.
Mhm.
And take us through that process of this DNC thing. I think that is very sad, to allow any woman to put, but I don't know what else you can
Um,
be done, but
so management of a miscarriage depends on how far pregnant you are.
okay.
Okay. So when you're early pregnant, there are 3 things. One is manage expectantly. In other words, just waiting to see whether your body will basically pass the tissue on their own. And that typically is more successful if somebody has had some inkling of them they have a miscarriage, they're spotting or cramping or something. They are more successful at just kind of waiting it out. Okay. So about 80% of people, it will come on its own within a couple of weeks. Now, that of course supposes that you are okay mentally,
Mm-hmm.
knowing that this is not a normal pregnancy and you're just waiting.
Okay.
Okay. So there's expectant management or conservative management.
Mm-hmm.
There is medical management,
Mm-hmm.
okay, where we give you medicine to try and make the cervix open and then have the tissue pass. And there are people who are like, I don't want to have surgery. I can't have surgery. So there's medication that we can give you to make the tissue, make your cervix open and you pass. Now, all of them are accompanied by bleeding. Okay, so it's amazing how much bleeding you can have during a miscarriage. People think it's some little cute thing and stuff. I mean, you can bleed a lot. Even I've been surprised sometimes how much bleeding can occur. I just did a DNC on Friday with a patient who, I mean, it was impressive. Um, so that's that. Then the third managed way is this surgical option. That's what you're talking about. DNC means dilation and curettage. So
Okay.
If your cervix is already open and the tissue is trying to come out, usually you're cramping, you're bleeding. And if it's right there, once you pass the tissue, your cramping goes away. Okay. Is when the tissue is trying to come out, that causes a lot of pain. Okay. So when we give you medicine to do it at home, the same thing will happen. You will cramp like crazy and it's very painful. But if you want to
Just
avoid,
like you're getting ready to have a baby, like breastfeeding.
well, if it's early, well, I'm not sure it's as severe as a full term one, but it's very painful. Okay. But once the cramping is done, that usually means you pass the tissue. Okay. Now, sometimes the about 20% of people will not pass all the tissue and they will need to have a dilation and curettage. A DNC is the most expensive way of doing it, but it's the most expeditious. So that's the one that finishes it quicker. Okay. So if you're early pregnant, that is one way, and that most people choose to do. Now, as you get more pregnant, the baby's head ossifies, it becomes more bony. Okay. So when it gets bony like that, you can't go and do a DNC. You can't go and curettage and get the tissue out. And that is when we give them basically medication and basically try and put you into labor. Okay.
Okay.
And then you basically deliver the baby. Now you may have doctors who do a DNE where they dilate and then they can go basically get basically tissue out. And it depends on your frame of mind whether you feel comfortable with that procedure. Okay. The dilation and extraction. And
Okay.
you need a person who is trained in doing that procedure. And that you can do. Okay. But even that is only done up to a certain point. Because once the baby gets to 20 weeks, something like that, that's not something that, like at the hospital, the doctor who does it will only do it up to a certain stage, would not do that. Okay. So that's when you do basically, you give them Pitocin or something and try and get them to go into labor. One of the worst things, in my opinion, is yes, you have a baby die at 24 weeks and then you have to now go through delivering the baby.
Exactly.
So,
Yes.
but there's
And
no way
most of
of getting
them
it
too.
out.
Yeah. Oh, that's a lot. If you're watching us on YouTube or Facebook, Facebook is where we have the most party. But wherever you're watching us, we encourage you to share, subscribe, ask questions. Gina, let us know if you have a question. Linda, let us know. Nanekia, Cynthia, Adelaide, if you have a question or maybe something happened to someone, you can just share with us and I'll be able to ask. And sometimes we have personal questions. And since Dr. Asare is on, you may not have an appointment with her or have a phone number, but you can ask a question and unrelated to this topic, but related to women's health, and she would answer it for us. All right, Dr. Sari, let me just switch the topic a little bit to epidural, because that's a question that a lot of people ask. I know it's not related to
Love
miscarriage.
it.
You love it. Well, I didn't get it. You remember when I got to the
That's
hospital?
because you came too late.
Well, I didn't come
Speedy
too late.
Gonzalez. You are
No,
fast.
I did not come too late. I came when the labor, as
Yes.
soon as I
Your
felt the
baby was
labor.
nice to you. You came fast. Your baby
Well,
delivered quickly.
that's a good thing because all the boys come a little early. And they, they come in and about four pushes, the babies are out. So that's good. I can't compare myself to anyone who's gone through
You
that
you
whole
you were lucky.
very, very, very blessed. All right, so let's talk a little bit about epidural. I know someone who has a chronic back pain because of epidural. Is this an accurate thing? Like, I see your face like, but so is this an accurate thing? Do people
Now,
develop
now,
back
now,
pain?
people complain about that. In medicine, you have basically you do science, okay, as opposed to anecdotal evidence. So I'm not going to dispute that somebody got an epidural and said since then their back hurts, but
Okay.
the science doesn't support it. Okay, so if I look at how many people I have delivered personally, majority of them in this country will get pain medicines. It just doesn't hold up. Okay. I think the people come in with preconceived notions. Our people,
Yeah.
if you do this, and so any little back thing, all of a sudden it
It's
must be the
because of
epidural.
it.
The science does not support it. Okay. But that being said, you can have, an occasional person who will say that's what it is. I mean, if you see that needle that is used is a teensy, winsy, wincy needle. Okay, it is the tiniest needle, and it does not. I don't see how it's going to cause chronic back pain all over the place from one little needle. And again, like I say, studies have been performed, and it just does not hold up. So me, when I said I love them, is because I don't believe you should be in pain when you're having babies. But that's just my opinion.
Well, but that is a natural thing. I mean, even if you have the epidural, when you're pushing, you'll still go through that pain, right?
Not necessarily. If you get a good one, no, no. The
Really?
best, the best epidural is feeling the urge when you get the pain, but it doesn't hurt, and you
Uh-huh.
can push. Right now, sometimes as the head comes out, you have
A tear?
the pressure.
Okay.
Okay. But it's not the same as before you got that pain medicine. I mean, people who've gotten it where for what reason, for whatever reason, it doesn't work anymore, uh, you know the difference. There is a big difference, right? Um, but no, I don't think. I don't talk everybody into. In fact, I don't. People come over, and I had somebody who came over and had a finger in my face. I don't want that drug, and I don't. And I was like, listen, it's not coming out my bottom. Whatever you want to do, no problem. But what I tell people is I keep an open mind because everybody's labor is different.
Yes.
Some people have very fast labors. Some people have
Me.
great pain tolerance. If you've never had a kid before, with all due respect, Dr. Google is not a guide. It's
Exactly.
like reading the driving manual and you haven't driven a car.
Mm-hmm. Mm-hmm.
You don't know until you get there. So I
Yeah.
tell you keep an open mind. And then it's not mandated that you must get an epidural. If you can do it, by all means, no problem. You know.
Yes.
But
Yeah.
if things are very painful and there's a way of making you comfortable, I don't think you're less of a woman that
Mm-hmm.
to be comfortable. And
Yes.
and I think that's some of the things that are done. Some people's mothers will come, I did it. You too, why are you doing it? But
I like what you said. It doesn't make you less of a woman to take the epidural. So if you need it, please go ahead and take it,
yeah,
right?
yeah,
So let's take some questions. I have some that is coming through WhatsApp, so I'm going to read them as they come.
yeah,
They might not be related to miscarriage, but it's related to childbirth and all of that. So,
that's fine.
first question is Cynthia: can having a cone biopsy cause miscarriages?
A cone biopsy can weaken your cervix. So anybody who's had a cervical procedure, okay. So cone biopsy is when you have an abnormal pap smear, and we're looking to see whether you have cervical cancer. And so it's a diagnostic as well as a curative tool. So we go in there and we basically take out a cone, a piece of your cervix, right? Now, your cells will grow back, but sometimes the integrity is not the same. And
Okay.
so anybody who's had a cervical procedure, we mark you on there when you're pregnant and we check your cervical length. And we check it at 16 weeks, 20 weeks, and 24 weeks. And
Okay.
majority of people do just fine.
All right.
But
But,
yeah,
but to her question, Dr. Sari, when is a cone biopsy needed?
a corn biopsy is performed, or what we call now a leap. We don't do cones as much. A
Okay.
leap procedure is we use an electrical wire and we remove an area of the cervix, basically looking like it could be like a cone shaped piece of tissue, and it's performed when you have an abnormal pap smear, and we do a procedure called colposcopy where we look to see whether there is something there. And if we do a biopsy and it confirms that the funny cells are there, we go and we do a curative procedure. Or sometimes we can't assure ourselves that there is not cancer there. Because a pap smear, really, the ultimate reason you're doing it is looking for cervical cancer. Okay.
Okay.
So an abnormal pap smear, depending on how abnormal it is and depending on how old you are, okay, may necessitate doing this procedure. So anytime you've had anything done to your cervix, it can cause weakness in the cervix. So a leap, okay, LEEP, a cone biopsy, okay, can all cause cervical weakness. Now, in the past, we used to have cryosurgery where we used to freeze the cervix.
Mhm.
That one causes a different problem.
Okay.
Okay. That one will cause stenotic cervixes. So when you go on labor, your cervix doesn't want to open because you have scar tissue there.
Mhm.
And you literally have to go in and break it up for
Mhm.
somebody to dilate. Okay. Um, so, but yes, very good question. A very good question. It can absolutely cause that. And you should tell your doctor if you've had any procedures so that they're on the lookout, looking out for you.
All right. Okay. So, um, someone sent a message. I want to send a private question. So, alrighty. If you want to send a private question, you can use the Jesus is Lord Crusade text um, phone number. It's 443-837-7983. 443-837-7983. You can send it there. I won't see your name, so don't worry. I won't know who you are. But the next question here is, okay, please ask the doctor. I have been experiencing painful sex lately. What could be the issue? Okay,
How
yeah,
old is the
what could
person?
be the issue?
How
What?
old is the person?
Oh, I don't know. I don't know. Let me just respond. How old are you? Okay. I don't know. But what could be a reason why she's experiencing
Most of the
painful?
time, there's no reason. But if it's something
Okay.
that's very acute, in other words, it just started,
Mm-hmm.
you know, you go and make sure you don't have an infection. Okay.
Okay.
That's one of the first things, right? The reason I asked how old she was as you get older,
Mm-hmm.
your vaginal tissue is not as elastic. Okay. So, generally, if you have intercourse,
That sounds funny in my head.
yes, it's
It's
not.
not the
Your
last.
vaginal, your vaginal, it's like wrinkles on your face, people.
I told you we should get a reconstructive vagina.
Don't do that, oh.
No, we have to talk
Vaginoplasty.
about that one. Maybe
Mm,
before we finish, we
that
should have
one.
a reconstructive vagina. You know
I
how
beg you.
people go and
Don't,
get a facelift? There should
mm,
be a vagina lift.
people are doing it. You got enough money, they'll do anything for you. But anyway,
Vagina lifts.
no, they're doing a whole bunch of laser things and claiming
So
all
what
sorts
does
of
it
benefits.
does it make it
Me, I
brand
don't
new?
go. Mm, I don't believe in it. You know.
Okay, anyway. Back
Anyway, but
to
no, the reason I asked is because as you get older, okay, so particularly around, perimenopause,
Mhm,
the time before menopause, there up to 10 years before menopause, and when you stop having your periods, you don't make as much estrogen. So
mhm.
your vaginal mucosa is not as elastic. Okay.
Okay.
So generally when you have intercourse, you know, you the vagina goes like that,
Mhm,
stretches away. It becomes less elastic, so it doesn't move away. And how you perceive it is dryness sometimes or
mhm,
pain. Okay. That's one of the main complaints of menopause.
mhm.
Um, and so, but check, make sure you don't have any infection.
Okay.
Sometimes, if you have a big fibroid, sometimes
Mhm,
when you have intercourse, it can hit. Okay.
mhm.
One of the simple ways is you have to change positions. Some of us are we train. Yeah.
Okay, don't go there. Don't
No, because it
don't go
depends.
there.
It
Oh.
depends when you have no when you have the pain.
Okay.
Okay, because the vaginal angle.
You know why I said don't go there? Because the Traxari, when you go there, it's going to be all hell break loose. So,
It's true.
but please.
You asked, oh.
Okay, all right, you go just a little bit. Touch on it just a little bit.
No, no, no. Depends. No, the
Okay.
the no, the vaginal angle goes back that
Mhm.
way. So if you
Yes.
have a retroverted uterus, your uterus tilts to the back. Sometimes when you have intercourse and they hit the back of your uterus, that can hurt. Okay, so you
Mhm.
have to change so it doesn't hit the back of your uterus, right?
Mhm.
But
Okay,
if
she
you think there's
responded.
only one way that you must have intercourse, then you're going to be uncomfortable, is what I'm saying.
Well, we'll keep that for another
Okay,
program.
fine.
Yeah, we'll talk
Yes,
that
yes.
later. All right.
Yeah, the one who changed the topic, oh, not
No,
me.
no, 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 I didn't. Okay, so she responded. She's 48 years old and she has not been lubricating at all.
Uh,
No lubrication.
I
So
rest
that's
my
the issue.
case.
Okay.
You see, it's menopause now. I beg you, go and get some lubrication and come back home.
Lubrication.
Mm-hmm.
Look,
It's
what kind
true.
of lubrication?
Coconut oil, my dear.
Sorry.
It's true. Astroglide. Listen, Astroglide. Okay. Any of the topical lubricants. Okay, so to explain, the vaginal dryness from menopause, you are not going to change it. Okay, the best example I give you is that, okay, so you have your dress. You
Coconut
have a size,
oil.
you have a size 8 dress.
Mm-hmm.
Okay, and you want to wear it. Now you're size 10. You use your lubricant, you wear your Spanx, and you squeeze into your size 8. But after you take off the dress, you're still a 10. So topical lubricants will work for when you use them. It doesn't solve the fundamental problem, which is that you're not making as much estrogen. So
Mm-hmm.
depending how bad the problem is, what fixes it is vaginal estrogen. And no, that is not oral estrogen, it's vaginal estrogen.
Estrogen. Okay.
But no, using topical lubricants, that's all you need. Is topical lubricants is what it is.
Okay, but long term, it's not a good thing. I think you need to go and check it out, right?
No, you should go check it out. But if she's 48, that's the most likely thing, really.
Oh,
No.
okay. Okay.
No, 48, I mean, that's why I asked how old she was, right?
Okay.
The most likely thing is that it's a very common problem. You
Mm-hmm.
know, I joke with all my menopausal women, who don't have a partner, and I said, when you meet somebody, come and see me first, though, because if you go and have a good time, somebody will have a good time. It ain't gonna be you because it's not gonna be pleasant.
All
Mhm.
right. The next question. I have had multiple C sections, and my area of incision still feels numb. Is that normal?
Yes, it is.
Okay.
Okay, when you cut on the skin, things will
Mm-hmm.
heal. It doesn't heal the same way. So
Okay.
when you touch where you've had the C-section, it just
Mhm.
feels different. It doesn't hurt, but it just feels different. Okay.
Okay.
And that is
Uh,
not uncommon. It's That's how it's going to be. It's not going to get any different.
okay. Alrighty. Um, I just see another lubrication question pop up, but
See?
you know, I think those watching just like social gospel. Oh my God. All right. Okay. Let's take that one quickly. Okay. All right. You said that evangelist. I'm not 48, but experience dryness almost every time. So can she advise me on that?
Okay.
Is it wrong to consistently use lubricants?
There's
You
nothing.
are just
No, there is nothing. There's nothing wrong with that. Okay, so here's the thing.
okay.
So everybody's different,
Mm-hmm.
right?
Mm-hmm.
Everybody's different. I always hear about, in Ghanaian parlance, oh, I'll call 10 rounds, I'll call, say, I don't know any woman who can do that and not get dry. Okay.
Okay.
Men
Say
and
that
women
in
are very different. Okay. Men and women are very different.
Mhm.
Now, have your husband piss you off and then want to try and come and touch you at night. Yeah, damn, yeah, whatever. You're not there. Women are very, and this is why there is no medicine for quote unquote decreased libido, because we are very complex and we are very different. Okay. So sometimes people want to do their marital duty. So husband goes like this, and you're like, okay, let me just try. If you are not there, you're going to be dry.
Okay.
Okay. And if you keep going a while, yeah. But
Mhm.
if lubrication works, you do. It's not going to hurt you. It allows you not to, be uncomfortable. There's nothing wrong with that. Okay. So please buy a bottle and let the good times roll.
Hey, Doctor, sorry. I'm not even sure what to say to you, but did you hear what she said? Buy your bottle and let the good times roll. Hey, what happens in your bedroom? Leave it there. Let's not even go. Look, I'm lost for words. All right, so let's take this other comment or question. All right, so it's quite a lot. Let me read it all to you. I have had 4 kids, and the epidurals never worked for me. Even though each time I asked for it, they gave it to me and it didn't work. Why is it like that? That's her first question. Her second question is also with my last child, after they gave me the epidural, about 10 or so minutes after, I started getting dark flashes and my pressure was going down. I pressed the call bell and they came in and did a whole lot of things to my body, injections all over. Was it the epidural that caused it?
I'm not sure I get her question. So she started having dark flashes. Okay, so So this is how epidurals work. Okay. So what controls pain is your nerves.
Mm-hmm.
Okay. So what epidural is that you go at a certain level in your spinal cord.
Mm-hmm.
Okay. You're not going into the spinal cord, you're going to the spinal sheath
Mm-hmm.
and you're injecting medication. Okay.
Yeah.
And then the medicine basically numbs, bathes the nerves that are coming out,
Mm-hmm.
um, and it basically makes it um, controls the pain. Now,
Okay.
the reason that before they do epidurals, they give you a lot of fluid is because your blood pressure is controlled by fluid volume, how much blood is going around,
Mm-hmm.
and your nerves. So when you take the nerves out of the equation, your blood pressure can drop.
Okay.
Okay. So despite doing all of that, sometimes people's blood pressures will drop. And if it drops enough, you will feel out of it.
Mm-hmm.
And your if your blood pressure goes down enough, the baby's heart rate will also go down and stuff. So I think that's what she's referring to
Okay.
in their thing.
There's a second part to it, though.
Yeah.
Also, with my last pregnancy, the doctor said she could only see an empty sac, and she offered to give me medicine to bring it out or to wait it out. Finally, they got a heartbeat, and the next time I went after 2 weeks, and the next time I went after 2 weeks, I think that's what she said. What caused that? I was about 10 weeks pregnant when she only saw an empty sac. What is an empty sac?
That doesn't make any sense.
Maybe it's the way I'm reading or the way
No, no,
she.
no. I'm hearing you, but what she's saying that doesn't. Okay, so when you get pregnant, at a certain stage, remember we talked about ACG levels.
Mm-hmm.
So your ACG levels, that's what you're checking when you do a pregnancy test.
Yeah.
Okay, you're detecting the level in your blood. Okay, there is a number or what we call a titer, and the titer will go up a certain number of points every couple of days. Okay, so in general, a normal pregnancy, about 66% of pregnancies, the level will double every 2 days. So
Okay.
some will not. Okay. And if it does not go up a particular way, and along with not seeing something in the uterus, that is diagnostic of an abnormal pregnancy. Then the question is it an abnormal pregnancy which is in the right place, i.e., your uterus, or an ectopic? Okay. An empty sac, what I suspect went on in her is that she probably was less pregnant than she thought she was. Because it makes no sense that at 10 weeks they will see no heartbeat. Okay. By 6 weeks, you see a heartbeat. So if you're very early, you will see a sac, you will see a yolk sac, you may see, you know, um, um, a fetal pole, but no heartbeat. And
Okay.
so you don't go and diagnose a miscarriage based on one sonogram in a pregnancy that is desired. Okay. You do not do that. So we all have seen places where we thought this is not a normal pregnancy. But if somebody wants to be pregnant, they are not bleeding, they are not cramping, there's nothing to make you intervene. It is perfectly fine to wait, repeat the ultrasound, because if 2 weeks after you see a yolk sac and a thing and there's no heartbeat, there's no okay.
Okay.
So that is not. I suspect she was less pregnant, and that's why they saw a heartbeat 2 weeks later.
Okay.
And
She
remember, there was no
commented a
heartbeat.
while.
Yeah, there's not like there's no heart. There was a heartbeat, and unless the person is totally incompetent, and just didn't see a heartbeat, you know.
She said that, is this safe to say that the doctor was lying to me?
I don't know. I don't think somebody would lie because I mean, well, I like to think about the best in everybody. We don't have a reason to go and say, or go and have a, go and do a DNC. No,
Okay.
that is not the case. Uh, if anything, I think we are very conservative about waiting it out. If you are not bleeding, now wait. I mean, the young lady I told you about on Friday, when I saw her last Monday, I knew it was a miscarriage because her dates. She was very sure about her dates, and the sonogram indicated a 7-week pregnancy, and there was no heartbeat. Okay, at 7 weeks you should see a heartbeat. And my sonographer I trust, and
Okay.
so I knew there wasn't like it wasn't a normal pregnancy because she was sure about her dates. And if you're sure about your dates and the dates say you should be 10 weeks, and you're measuring 3 weeks behind, and there's no heartbeat, that is not a normal pregnancy. Okay. However, she wasn't bleeding. She was a desired pregnancy. So I asked her, come back in a week. But then the pregnancy declared itself to be what I thought it was, which is she started basically bleeding, right? Some people may come back in a week, and in a week, okay, if we screwed up and the baby's heartbeat was there, we missed it. By now, you should be 8 weeks pregnant, and there should be a heartbeat. And usually, you will come back in a week, and it'll be still 7 weeks and no heartbeat. And
Okay.
that's how you confirm it, right? So I suspect in the young lady on there that she probably was earlier pregnant. You know, a lot of time people would not remember their last period. They kind of pull it up. Oh, I think it was here. So we put one down, and then it's not the case. And
Okay.
then, so if we are not sure, I mean, I rarely. People will sometimes you tell them, is it? Oh, no, 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 no. I told you the wrong date. Unless you bring me that calendar, I always assume that most of us might not remember. So you err on the side of being conservative, right? So
Okay. So
I don't know what hospital she went to about the epidural. All four of them not working. Such bad luck. You should come to the hospital. They are very good.
all right. So this question is: I've had 7 miscarriages. Oh, I was so sorry to hear that. I've had 7 miscarriages, and every time the doctor tells me there is nothing wrong with you, all my tests are good, but I don't know why I'm failing in this area. You're not failing. You're not failing. This is not new. You're
How
not failing
many
at all.
how many weeks
Seven
is she talking
miscarriages.
about?
She
Because
did.
okay, so
Let
here's
me
the thing.
reply. Let me just reply and ask how
Mhm.
many weeks is that? I don't know. So
I
this
mean,
is
because
it's not
because because
Jesus is Lord pay, so I don't know. But she's had
because
7 miscarriages.
no, because sometimes people will count what I call chemical pregnancies as a
What is
mistake.
a chemical pregnancy?
Okay, so you want to be pregnant, so you are sitting there just waiting, and then you go to the store. So at 3.5 weeks after your period, you haven't even missed your period. Oh. You go and take a pregnancy test, and the thing says the blue line is there. And then 5 days later, when you ordinarily are getting your period, you get your period. That's a chemical pregnancy.
But why will the pregnancy test show positive when you are not? Uh,
No, you barely were pregnant, so you didn't get anywhere. Okay, so if she was not looking out for it, she wouldn't even know she was pregnant. Okay, so if you are not looking to be pregnant, you would have gotten your period on the day that you expected it, and you wouldn't know you were pregnant. So now
but there,
people,
but Dr. Sorry, there are also those who actually go through this. You know, keep losing their babies. Sometimes 3 months, 4 months.
oh no, 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 those are different. That's why I'm asking how far, because I have people who come when I ask them, "Have you been pregnant?" Yes, I've had this. I said, "How far pregnant were you?" And then she said, "Well, when I was, I tested, and we don't consider that because we know that there are many undiagnosed pregnancies. Basically, it's barely there. It didn't go anywhere. You didn't, the embryo didn't form. You barely made anything. I don't think I would consider that to be a miscarriage when you basically didn't even miss your period. Okay. Yeah. If you
She
do,
said
if you do,
that.
no, if you do IVF, for example, okay, they put the embryo back and they start testing. They'll do the first test usually a week or something later, and you get a 5 or something, and then it goes to negative. They don't consider that a miscarriage.
She said that I thought I'll be okay asking this question. And I really thought that I was through with this, but just thinking about it makes me cry. Ask
Absolutely.
her if there is any hope at all. I think maybe this will be yeah, this will end our conversation today.
How old is she?
Ask her if how old is she, Aaron?
I mean, I always have hope.
Okay. So medically, Dr. Sari, before I bring in my spiritual part, of course you know where I stand, but medically, medically, is there hope at all?
Well, it depends on how old you are and what your evaluation has said. When you said, I asked my doctor, what has she been tested for?
She's 39 years old.
Yeah, you're 39, you're not menopausal. Absolutely.
Okay.
So the question is, what tests have been done, right? And has she really been tested for the weird outlying things? Okay.
Mm,
There are weird outliers, antiphospholipid syndrome, the weird things that are not very common, but that can cause somebody to have recurrent miscarriages. So it depends on, have you gone and been worked up for recurrent miscarriage? And if you've been worked up for recurrent miscarriage and, um, everything is negative, then I will try. It all depends on mentally, whether you get the strength to
mm.
give it a try.
That's good.
That
That's
is the thing. Because
that's.
mentally, it's very difficult to keep picking yourself up
Mm-hmm.
when you keep getting knocked down. Absolutely. Right.
Mm-hmm.
Um, but if you're 39 years old, you're not 49. So by all means, if you have the mental strength to try,
Mm-hmm.
okay. But I'll be curious to know what tests have been done, right?
Yeah. Yeah. What tests have been done?
Mhm.
Well, I'm sure if we go on, there are other questions that came in, but I guess I'll send some. One person says they're gonna come and see you later, so I guess
I'm
you're gonna
busy.
get an appointment very soon. Well, we thank you so much, Dr. Sari. We're just about 10 minutes out, and we want to say thank you so much for coming on today. What will be your number one advice for all the women that are watching right now, and especially whether it concerns miscarriage or taking care of our little area, our girls, and all of that?
Keep yourself healthy. Okay.
Mm.
Nanaya and I always fight. Watch your weight, eat healthy. Green tea is good. Milk, you mate.
Oh, just a little touch of
Oh no, no, keep yourself
a little touch, just a little touch
as
to give me the kick.
physically fit as you can. Okay. um as we get older, there are certain illnesses and things that sometimes just come along, and you want to be as healthy physically and as emotionally as you can.
Yes.
Certainly don't give up hope. And we are blessed to be in a country where you can go and look and see if there's something that can be helped. um, but I always tell people, and this is hard for me to tell people, when people come, I'm trying to get pregnant, and this, I always say that having a kid does not define who you are. It does not. If you are not blessed with children, it does not make you less of a human being or a woman. It does not. Okay. Now, after saying that, then I go, okay, now go over and do everything you can and see if you can make it, right? But particularly before IVF and things, because before you go, you put everything there, you have your hopes and everything up there, and it sometimes it doesn't work. As somebody who did 10 IVFs, didn't work. After she adopted, guess what? At 42, here she is with a kid.
Yes.
Even I had given up, right? And so you go and you get yourself mentally and physically as well as you can be, and then you go for it. Um, but I believe in healthy living, exercise, watch what you eat, do everything you can, and if you do have any control over it, try earlier in your life to have children.
To have children.
Try
There's a
early.
good question that just came in. I think that would take us a while, so I will just can you answer it shortly for us because we have to be done in the next 7 minutes. She said that I have two autistic children, and I keep wondering, is there anything I did to deserve this? Oh, I
No,
don't think you did anything to deserve it. I'm sorry.
no,
No,
no, absolutely not.
no, absolutely not. No.
Absolutely, it has nothing. It's nothing to do. You ask for children, and you you get what the good Lord gives you, and it has nothing to do with stuff. Sometimes there might be some small genetic something which you're fine, and then you go to have kids, but it's not you.
Yes,
You
it's
didn't
not.
do anything.
You
You
didn't
know,
do anything.
it has nothing. It's like miscarriage. People come and no, it has nothing to do with you. Nothing. Okay.
I'm going to reach out to you after the program, and for medical advice, I will definitely connect you to Dr. Sari's office. And she's very good with that, and she can also counsel you or talk to you She said that I'm hoping to have a third child. Hopefully that will be better. Not I have a problem with that statement because the two are equally good.
They're good.
And you can have a third child. I don't have an issue with that. But I think that it
It
is
is, it
how we
is, it is,
change.
it is, it is challenging. It is
Yes, it
definitely,
is challenging. I
it
don't
is
want us to
challenging.
have that. Yes,
Yeah,
it
it
is
is
challenging.
challenging. But you know, the blessing in that you are in this country where children with special needs are valued, and
Yes,
try and get them to their full potential like
yes,
anybody else.
yes,
You
yes.
know, unlike back home where, you know, they put them somewhere and they don't acknowledge them. So thank goodness that you had them in this country, I hope.
Yep, yep,
And you will do avail yourself of all the services that are available to you.
yes.
And, you know, and they grow up and, you know, they do well. It's challenging.
It's
Absolutely.
challenging. Yes, so I
Challenging.
agree. I
Yeah.
agree to what Dr. Sari is saying. It's challenging. We feel your pain, but
Yes.
there's a way I want you to look at it. You know, sometimes the way we look at things, it helps us to shift our focus, and we're not always embracing the negative part of the issue. And so I hope that we can have a little chat after the program, and then I will connect you. There are about 4 questions that we didn't get to answer, but I will connect you to Dr. Sari's office. Some of you want to make an appointment with her. Go and see her. She's a lovely, lovely, lovely woman. She's sweet, just the way you see her. And just be ready. I mean, when she's comfortable with you, you guys will have the all kinds of things happening in that room, especially when you get your pap smear. Yeah, yeah, yeah.
Ah,
That's
yes.
I have a lot of fun when I come to you to get my pap smears.
Hey, Nanaya,
Yes,
you're
it's
pastors. Are you sitting here saying that you?
well, but I didn't say anything wrong. I'm advising them to get their pap smears. Is that
Yes.
wrong? It's
No,
not.
no, 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 no.
It's
Pastor.
not. It's a
Because
good
your
thing, and
husband,
it's really, Doctor. Sorry,
we
that
do
is
have a good
we
time.
do get it done. Yeah, and we
We
have a
do
good
have a
time.
good time. We really
I
do.
mean, depending on what somebody's thinking as a good time, now that's a whole thing. You know, it's a conversation. The healthy conversation that goes on. Please, please, come on.
We do have a good time. Yeah.
Yes, we do. Dr. Sari, we love you for coming. Thank you so much for always being candid with us. That's one thing I love about you. You don't fake anything, you call a spade a spade. And so we're grateful to have you on to really spill the beans on what miscarriage is. I think we have to do one on cervical cancer
Ah,
maybe in the
yes.
near future. That's a good one, right? Cervical cancer and many things that women go through. I think it's been a challenging year, and still a lot of things are
Oh my
happening to
goodness, has
our
it been ever? But we're at the end. Get your vaccines, ladies.
get this woman. Okay, you heard.
That's
Oh,
the only way we can get out of this. So please.
so, alrighty. So we want to thank you all for watching Afternoon Tea today. It has been my pleasure to host you. We pray that you learned something today. And like I said, Dr. Sari's office is always available, open. And if you want to change your doctor, I would recommend her. She's a good one. She's just a good one. And we hope that you're learning something today. You're excited about the program. Please share. Hopefully, something that was said today can change somebody's life. And just, to go back on the scripture that I read before we started, Habakkuk chapter 3:17. It might not seem that things are working right now, but like she said, medically, there's hope. Spiritually, too, there's hope. For those of us who have made Christ as our personal savior, we have hope in Him that no matter what goes on in our lives, the sun will always keep shining because He is over us. His banner over us is love. So I want to encourage you, don't give up. Don't throw in the towel. Don't say to yourself that, oh, this will never happen to me. The things you declare out of your mouth, it will happen. And so I want to encourage you, hold on to your faith, hold on to your belief system, and let's keep trying. We're praying with you. And look, you can reach me at any time. I will pray with you. If you feel like crying or whatever the situation is, go ahead and do that. There's no right way to console you if you've lost a child or not. At the end of the day, I have heard many countless testimonies. I know someone who went through this. And Dr. Sari, I'm sure you have also countless testimonies of people that went through several miscarriages, but now
Absolutely.
have about 2 or 3 or 4 children,
Ah,
right?
you can't stop them.
You can't stop them. So, hey, when the pipe opens, it will keep flowing.
Mm-hmm. Mm-hmm.
when the pipe opens, it will keep flowing. So we love you again. Thank you all so
Thank
much.
you guys for having me. It was a pleasure.
Oh, thank you, Dr. Sari. So we want to have you again, maybe
No
self-confidence,
problem.
something else.
Let me know.
I know you will
That was
come.
a fun. All right. Bye
Thank you.
bye.
All right. Bye-bye. Bye-bye. Alrighty. Happy Monday, everybody. God bless you. Thank you for staying with us all this hours. What it's been what an hour and over. Yeah. So we want to say thank you so much. Thank you so much. God bless you. Love you so much for watching today. And we say that happy Monday to you. We'll be back next Monday. Share this broadcast, invite someone, and I'm happy to share Dr. Sari's information with you as well. Her office information and all of that. We'll put it up on the Jesus is Lord Crusades page, or you can just send us a message to the Jesus is Lord Crusade number, and then I'll be happy to share all the details that you need. And for those of you who sent questions that we weren't able to get to it, I will send it to her. Let's see what she comes up with. And then also, if you need prayer for anything, it doesn't matter what, I'm available to stand with you. So the Lord bless you. Have a wonderful day. Friday, Night of Healing is on 7 p.m. Eastern. So join us. Alrighty? Have a good day. Thank you for watching today.
Thank you for watching today's broadcast. Jesus is Lord Crusades is an international evangelistic ministry and the ministry of evangelist Marian Anim. For more information or to support the ministry, go to www.jesusislordcrusades.org and click on Donate. You may also call in donations or questions by calling us at 301-679-5554. Please share, follow, and subscribe to our Facebook, YouTube, and Instagram pages, and click the like